All right, good afternoon, everybody. Here again with Josh and Paul, a couple of guests I'll introduce in a few minutes. I just wanted you to know that we just got out of our weekly video conference with Vice President Pence and the White House COVID task force. Sort of interesting how we line up compared to most of the states out there, like Connecticut, are seeing the hospitalizations going down and testing ramping up in a serious way. And that's what this first slide says. It's sort of consistent with what we've seen more or less over the last week or so. Deaths are continue to be high, lagging indicator. Hospitalizations, this is the biggest drop in hospitalizations that we've seen, and you know how important an indicator that is. Next slide. Again, you'll see that not only is Hartford, New Haven, but now also Hartford is flat and going down. In fact, Fairfield County is down about 13% since its peak. So that's extraordinary good news in terms of what that means to our future. Another way that we look at it, as you know, is from hospitalization statewide. Here you can see what the three-day moving average is. And you can see that trend line is trending down. And as you maybe remember from the White House task force, they had said 14 days of consistent downward trend, you're moving in this, what they call Tier 1. And Tier 1 is pretty much where we are right now because we never closed down our parks and beaches. It gives hospitals maybe a second look at thinking about elective surgeries. So this is where we could be in another week, assuming this trend line continues, which is so positive. We had an interesting conversation with the task force. Most of our fellow governors, like ourselves, are ramping up the testing. We've done well just because of our relationships, as you know, with CVS and some of the other partners out there, Quest, of course, Thermo Fisher. One of the things that I pointed out is rather than over-relying upon the drive-through tests, we're making a big point of making sure those tests also get out into the community, especially the urban communities where people are a little less likely to be tested. You heard that with a Quest the other day, and you're going to hear a little more about our mobile van as we get more people tested, especially in underserved communities where people may be more likely to be infected and have serious consequences. All the governors we talked about the flare-ups. It's not a consistent straight line. And obviously, as you look around the country, you see the New York metropolitan area going down. We're part of that. You certainly see Louisiana. You see Detroit. These are all good trend lines. But as I've said before, Boston is flaring up. Philadelphia is flaring up. So they're following this almost on a heat map that we get to see as you try and track what those trends are out there. All of our states have flare-ups in those more congested places, starting with nursing homes and correctional facilities. We've been pushing pretty hard on FEMA and the feds to help us out there, just like all the nursing homes are pushing us pretty hard to be helpful. FEMA is stepping up. Better late than never. They're going to have a big delivery to every single nursing home in the country, in all of our nursing homes, of more protective gear, and starting with the masks and gowns. And that starts shipping out on May 1st. It ought to be completed about 10 days thereafter. And that's on top of the incredible increase in a PPE that we've been getting distributed to all of our nursing homes as well. And that's on top of the fact that we're going out doing physical inspections of these nursing homes. And Josh tells me about 2/3 of those homes have been inspected. And if there have to be corrections in terms of infectious or cleaning, we're ready to do that and have instructed them as such. I was a little surprised, but not shocked to hear about another disruption because it impacts the food chain. And those are flare-ups in some of the compressed food processing places. You maybe heard about what happened in South Dakota. There the meat packing, almost all of the infections in South Dakota are in and around that meat packing facility. Then we had the governors of Maryland, the governors of Virginia talk about a similar flare-up in poultry and on the farms there and the processing there. So makes you think a little bit about our food supply and the food chain out there, food supply chain. And it's something where I really like to see the federal government take the lead, because obviously we get food from all over the country, so does every other state, and having the logistics of that set up would be best done on a federal basis. But here in the state of Connecticut, we're going to take the lead in any way we can when it comes to food and food security in that supply chain. And I couldn't think of anybody better to take the lead on that than our Commissioner of Agriculture, Brian Hurlbut. Brian understands, A, what we can do for ourselves, and you know how important that is to me by way of philosophy. You know, we were just brokenhearted to see that our dairy farmers were pouring away unused milk because it's not as necessary in our restaurants and the such. Well, we're coming up with strategies now to be able to compensate the farmers, be better able to get that food, get the logistics, get the refrigeration, so it can be distributed not only in Rensselaer Park with a food share and the hundreds of people lining up because they desperately need that food, but also some of our farm to table and fairs that we'll have later on. And we're working closely with Deirdre Gifford, our Department of Social Services, expanding SNAP, like food stamps, so that people will be able to go to our farm tables and be able to get fresh food and pay for it with SNAP. We're working closely with Ford CT, which, as you know, is our philanthropic effort, where we've raised over $15 million, and see if they can help provide some of the legwork, support for our farmers, just to keep that flow going. So thank you, Brian, for stepping up and helping us on this. Lisa Tepper Bates, as well as helping us get the people power we need to make sure that this works in a real way. The other thing that Deirdre's working on in terms of that food supply chain is our restaurants. Find ways we can give them more activity. Right now, please call up your restaurant, and if they have knock and dash, if you can pick up to give them extra support. And we're going to work with them any way we can to help them in terms of preparation of meals and delivery of meals. Working closely with DoorDash is one of Grubhub, a number of companies that can help with the delivery of meals to our seniors and those who are under quarantine. And I'm afraid this is probably going to go on for some time. So these are all facets of the food chain that we're trying to accelerate as best we can. Finally, with the White House task force, there was some congratulation about the supplemental 3.5, so to speak. It's, as you know, billions of dollars for the small business, so we can ramp that up, $300 billion to be exact. And again, that's going to be available, Paul's just told me, Monday, 10:30. That's when they'll take new grants or new applications. And as you heard from Glenlyn Thames the other day, work with your local bank, work with a community bank, go to PayPal and some of the electronic fintech companies. Those are ways that you can get to the front of the line. Connecticut did pretty well last time. We're going to do even better. I want all of our small businesses taken care of by what we're doing. The hospitals, $75 billion, $11 billion for testing. And we spent a lot of time with the fellow governors, what we're doing in terms of testing strategies. Phil Murphy, New Jersey, talking about the saliva test. A lot easier to self-administer, a lot quicker to be able to get that in the field. Probably has to be at the lab so we can get that out there. So we're making progress on that, and there'll be resources for that and resources for track and trace. And other governors are using some of the state employees, using volunteers, using public health departments, and we're going to be rolling that out over the course of the next week or so. Finally, some frustration, again, from all the governors as regards support for hospitals, support for small businesses, support for airlines, but no support for state and local government, no support for the teachers and the firemen and the nurses, and a lot of people who are on the front lines here in this COVID crisis. And I had the opportunity to point out to the Vice President, this is not a traditional recession where income tax revenue goes down and then goes back up. That's what happened in the last recession, and we can prepare for that, and we did prepare for that. But in this recession, it's not just income tax, but it's sales tax that has taken a big hit. And you know why. You saw the graphs from yesterday. That's restaurants and bars and hospitality. And that hits Connecticut and it hits other states really hard. And there's some question how fast the hospitality is going to come back. And that's why we have to think about support from the federal government, us trimming our sails, being lean going forward, husbanding our rainy day fund to make sure we're there, 6 months and a year from now, in case we're not totally on the backside of the revenue cliff that we're facing here. With that, I want to just give you good news and introduce you to two friends of mine who have just been invaluable. And first off is Kathy Szilard. Kathy is the CEO of Stanford Hospital. And I really wanted Kathy to be here for a couple of reasons. One, she has a close partnership with General Yvonne and the Connecticut Guard and everything they've done to set up a field hospital there, which has given them the capacity to make sure that nobody gets left behind. We free up beds for the intermediate care and the such. And just as importantly, Kathy and Stanford Hospital have been early on in this. Maybe, just maybe, they're on the backside of the surge right now, and she can give you some good insights to other hospitals and folks around the state what Stanford has learned from having been in this for well over a month now. So let me first introduce Kathy, and then we'll get to General Yvonne.
Everything they've done to set up a field hospital there, which has given them...
Kathy, are you there?
Yeah, I am. Yeah, there's a little bit of a delay, so I wasn't quite sure there. So first of all, thank you, and hello, Governor Lamont and General Yvonne. It is wonderful to see both of you, and I want to tell you a little bit about what's been happening in Fairfield County. As you know,
you're watching the press conference. Can you turn off the press conference if you can turn it off?
I think your TV in the background has created an echo, perhaps?
Yeah, maybe. Yeah. I think I don't hear it now.
No, okay? You're good now. You're all good.
Okay, yep. Great. So thank you so much for this opportunity to tell you a little bit about what's been happening at Stanford Health in Fairfield County. As you know, because of our proximity to New York and New York being the epicenter, we definitely had some big challenges early on when we became a hotspot. We began to prepare very rapidly to prepare to accept COVID patients. We actually had our first COVID patient more than 6 weeks ago. We more than quadrupled our intensive care unit beds, and we were able to increase our total bed capacity by over 150% to over 500 beds. And we have been working collaboratively with other hospitals in the state. I'm really feeling so good about the collaboration that has occurred between our organizations as we began to figure out how we could help each other with supplies, staff, ventilators. Incident command leaders began to communicate with each other on a daily basis so that we had real-time knowledge of what the unmet needs of each organization was, and that we were able to assist each other. We transferred some patients, critical care patients, when we became full to Hartford Health and Yale New Haven, and likewise patients have come back to us as they've been further hit so that we can support the unmet needs in the state. I also want to, I would be remiss if I didn't mention the extraordinary work of our doctors, nurses, respiratory therapists, housekeepers. Their selfless and continued determination to help us in this pandemic has been very inspiring for every single one of us. As the governor mentioned, we are seeing a teeny bit of a downturn. And one of the things that was exciting for me today is that our non-COVID patient population exceeded our COVID patient population. We have about 120 COVID patients in-house today, and we have about 155 non-COVID. And that's important for a reason that I will get to in a moment. But one of the things I wanted to mention and give a real shout out to the governor about is that he recognized early on that this was something that was not going to be able to be handled by any one organization or any one entity. And he created the Health System Response Team. And Josh Gabal, I know, is here. I've spoken to Josh probably early on once a day about some of the things that were happening in Fairfield County and at Stanford, and received great help. But we realized as the surge was hitting Stanford Health that we were going to need additional resources. And as a result of that, the governor was able to help us by calling in the National Guard to come to our campus. We were in a very fortunate situation in that although we have a brand new, beautiful hospital, we had a mothballed, if you will, old hospital with 180 beds in it, that with the help of the National Guard and our own facility staff and housekeeping, we were able to repurpose and to get that hospital up and running within a weekend, which was really miraculous. And as a result of that now, and working with what is called the Urban Medical Task Force, with the National Guard, we now have that hospital up and running, and the task force integrated somewhat seamlessly with our own staff, and they are now staffing 24 beds of COVID medical surgical beds in the new hospital for COVID positive patients, again, integrating seamlessly with our doctors and nurses. And then in the old hospital, we opened what is called an alternate care site, where we're caring for less ill medical surgical patients and patients who are transitioning home. And I'm happy to tell you we are sending a lot of patients home. Now, I think over yesterday, we had over 215 patients who were discharged home, which is really feels good for everyone. And so they're now operating the alternate care site where we can decompress the acute care facility and help the community. There are so many lessons learned, and throughout this entire process, we've shared them with our other hospitals in the state and other hospitals outside the state that are experiencing these surges. We learned about cohorting patients and preserving PPE and all of the medical treatments that worked and didn't work. We're having great results with remdesivir and plasma therapy. We were the first hospital in the state to actually receive a research grant to begin to use plasma therapy. And we've had miraculous results with our patients. So this is convalescent plasma donated by patients who've had COVID-19 that is then administered to patients who are critically ill. And we've seen patients get off ventilators within a much shorter period of time. We had an obstetrical patient who delivered and had to be ventilated on a ventilator, received plasma therapy, and now is fine and getting ready to go home with her newborn. So these are the fantastic stories that we love to tell. We also opened up what's called a high flow oxygenation unit. We've learned that sometimes ventilator support is not the best therapy. And with high flow oxygen, we can oxygenate the patient and maybe avoid intubation and ventilator use. One thing I did want to mention is that we are having a concern about people postponing other types of care. And although we're still delivering babies and doing all the things that we normally do, some patients are postponing cardiac care, other types of care, because we've shut down all elective procedures. But just this week alone, we had to do some urgent cardiac procedures on patients. So the one thing I do want to mention as a public health advice to the community is that if you need care, you really need to seek that care and not avoid it, because we are here to take care of non-COVID patients as well. I heard from the pediatricians that parents are avoiding vaccination, which will obviously have implications further down the road, and we certainly don't want to see that happen. But I can't underscore enough the support that we have received through the task force and how they really allowed us to stretch beyond our own imagination. I said to our staff a few weeks ago, I'm asking you to do the impossible, and they did the impossible. But that's because we had so much support and that we worked together collaboratively to make that happen.
Hey, thank you, Kathy. That's inspiring. And I love the way people are looking out for each other. When you were crowded, Hartford Health was there to help out Stanford Hospital. Now with Bridgeport overcrowded, Stanford's there to help out Bridgeport. I love what you say about the plasma therapy. And folks who were infected and have the antibodies, now that therapy is helping to save other lives. That's a story I love to hear. Here's my great friend, General Ivan. We've done some traveling together, and he's been on the front lines of getting the field hospitals up and operating with our amazing Connecticut Guard. General?
Thank you, Governor, for the opportunity to speak today on behalf of the 5,000 soldiers, airmen, and members of the organized militia. First and foremost, our thoughts and prayers to go out to those who have lost a family member to this pandemic. And secondly, I definitely would be remiss not to mention the more than 1,000 men and women of Connecticut's home team that I'm blessed to lead every day, who have stepped up to the plate to face this challenge on behalf of the state. One of the main reasons we've been successful in flattening the curve has been due to your leadership, the governor's leadership, in aggressively and proactively taking steps to prepare for this battle since day one. Because of that, we have moved at and above the speed of relevance, getting capabilities and resources in place before they are needed. One of the best examples, and really it's become a nationwide practice, is the cooperation down at Stanford Hospital that you just heard about. We had an infantry unit clear, clean, and prepare an old tower that Kathleen just mentioned in order to set the conditions for incoming medical providers. This was key, very instrumental, as the providers were immediately able to be integrated into patient administration. And again, a nationwide model that other states are following. We have our state guardsmen working direct patient care alongside our federal military partners from the different services. We have Army reservists, the United States Navy, and the Air Force, a true success story. And because of this cooperation, that team has treated over 102 patients to date. Another great example of the public-private cooperation is the CVS Rapid Testing Site in New Haven. We have soldiers, airmen, alongside Connecticut State Police, assisting with traffic control and power generation that enables over 700 tests per day. This is just a small slice of our over 32 mission sets, though. To say our guardsmen have been busy would be an understatement, but some of their missions that we have completed or now have in progress include 24/7 warehouse management to receive and distribute medical and protective supplies, daily PPE points of distribution to the 5 DEMAS regions around the state, ventilator inspection and delivery, over 306 to date. A great new initiative that started today, our civil support team, who normally has the responsibility of detecting weapons of mass destruction, is performing mobile COVID-19 testing. Today, like I said, was our first one at Charter Oak Health Center in Hartford, and I think there were over 25 tests conducted. We've been deeply involved with public health on the medical planning side. We have talented guardsmen with a wealth of both military and civilian experience working for organizations like the Red Cross and Pfizer that are working hand in hand with public health on forecasting needs before it happens so we stay ahead of demand. Additionally, and overall, we've added nearly 2,200 beds of recovery capacity at a total of 20 hospitals, schools, and long-term care facilities. Our state organized militia, the governor's foot and horse guard, they're operational now. They're an operational force, and they deployed 4 DPH mobile field hospitals in order to contribute to those hospital surge plans. We are working with the Yale University Occupational Health Program on an antibody study to help determine what sort of immunity exists within the community. This initially started with 100 volunteer guardsmen, but now we are shifting our focus from building this surge in recovery capacity to working at how we can increase testing capacity to posture the state for reopening. Many of our soldiers and airmen helping here in this crisis are the same ones who deployed and returned from overseas this past year. These are selfless servants who have both worked in both roles. They have gone to war and now here are fighting at home, fighting the virus here on your behalf. I'd like to close with a good news story and an example of who your guardsmen are. Airman First Class Ariel Robles. She's an exercise science major at Central Connecticut State University and an administrative specialist with the 103rd Maintenance Group in East Granby. She has significant interest in healthcare and plans to continue her education with a master's in athletic training. Oh, by the way, that the State Guard is paying with 100% tuition waiver for state universities. But this week, which is key, she returned to school to the same building, Kaiser Hall, where she takes many of her exercise science classes. But this time, she was transforming that facility into a recovery center for people healing from COVID. Just simply a true replication of what our guardsmen do. We are your neighbors. We live in your communities. We are your National Guard. and we are all in this together, working side by side with our state partners and federal partners. Thank you again, and on behalf of Connecticut's home team, we will get through this. Thank you, Governor. Back to you.
All right, thanks, General. I look forward to meeting her. I used to do some teaching at Central Connecticut State, and I think you mentioned to me that, were they previously in Guantanamo?
Yes, sir, exactly. They returned, and you and I visited.
Where we
I think it was a
visited
couple
back
days
in
after
December.
Christmas.
Just reminds
sir.
you how much heart and passion our guardsmen have and how they keep us busy and they keep us safe. And that mobile testing facility is amazing. If you're not going to come to us to get tested, we're going to come to you. All right, Max, any questions?
We'll start with the Associated Press.
Good afternoon, Governor.
Hey, Sue.
I'm looking at a document that came out, I think, 3 days ago, and it's from the Public Health Commissioner, and it says that she is going to be extending the ban on visits to nursing homes and elderly care facilities until September 9th. Is this a worst-case scenario, or is this something that's actually happening?
I don't know about that date. Do you, Paul?
I think Josh will be able to answer that one.
Yeah, we can always adjust that if the public health conditions merit.
What was the point of putting it out now? And why didn't we know about it sooner?
I think it's just setting expectations given the current situation.
I got to say, Sue, I mean, we got hit a little bit because we were one of the first states to say no visitations to these nursing homes just because of the nature of the infections there. So I think Renee was probably being cautious. I think putting a date out there, we got to take a look at that because who knows what we look like in 2 or 3, 4 months.
And I wanted to also clarify, when you were talking about we may already be in stage 1, can you explain, like, because those are federal stages, where you see us now, when you see us getting to 1, when you seeing us getting into 2?
No, that's a very good question. So the task force is pretty clear. 14 days of declining metrics. That's hospitalizations and infections. So let's look at hospitalizations, since that's the one I think that we take the most seriously as a barometer for more broad-based infections out there. And we're down about a week on that if you just saw that 3-day moving average. It's not a straight line, but it's a moving average. So in another week or so, we'll be clearly in what they call that first tier. And we're already sort of there because the first tier says, parks and beaches can be open as long as you practice social distancing. We never close those down. They take a look at elective surgeries because they say perhaps you'll have some more capacity in those hospitals since it's drifted down. So we're going to be, I think, solidly in that tier 1. And then by that May 20th date, assuming those lines keep going, that gives us more flexibility in terms of, for example, small businesses, retail, and the such. And that's following the guidelines of the CDC.
Move along
So
next.
can I just clarify too that the September 9th date is the duration of the current public health emergency, so it enables us to not have to go back and re-extend it, but we can always shorten it if public health conditions improve.
Okay, thank you, Josh. Thank you, Governor.
Move along next to News 12 Connecticut.
Hi, Governor. So today, the State Health Department held a conference call, and we asked them about these pictures we've seen of nursing home workers covering themselves with trash bags that the unions have put out. The health department said that they investigated and found that the workers actually prefer using the trash bags as opposed to standard issue PPE. The union fired back this afternoon and said that they're shocked by that statement. They said that's completely not true. Can either you or Josh speak to what you know about workers having to use trash bags in nursing homes?
Yeah, I'll start with that, and then Josh can back me up. But these guys can go back and forth and point fingers and place blame. I'm here to solve problems. I'm in charge of the public health and welfare of all the people of Connecticut, including folks who work in our nursing homes, those incredible first responders. As you know, we have scoured the globe getting PPE. Every day, Josh and his team at Public Health are in contact with the nursing homes, doing everything we can to make sure that they get the protective gear that they need. And I think we're doing well on that compared to what I've seen in other places. And every day we're getting them more gear. And now FEMA is going to be getting them even more gear starting on May 1st. Nursing homes are private entities. You know, they can go out and get the gear themselves, but we're out there getting it for them. And the unions, they look out for the public health and welfare of their workers. They can go out and get the gear and look out for their people as well. In the meantime, I'm going to take this on my shoulders and do everything I can to keep these people safe.
Yeah, John, just to be clear, we've received 2 reports of someone wearing a garbage bag. It's completely unacceptable in a healthcare environment. So those are obviously investigated when we hear about them. We don't have any evidence this is a widespread practice. And in both cases, the investigations yielded that was the employee's choice and that there was gowns available in that facility. So it could have been an issue of training. We're not entirely clear, but one was actually a food service worker, so not providing direct care. But if there are other instances, please ensure that they're reported to our Department of Public Health. We follow up and investigate all issues.
So Josh, these workers, I assume, were told that that's not acceptable. That's not something the state wants them wearing.
Certainly not consistent with best practices of infection control, correct?
Move along next to the Waterbury Republican American.
Thanks very much. Governor, I had a chance to speak to the state director of the National Federation of Independent Businesses. They represent a lot of small businesses, I'm sure you're aware. And they're concerned that whatever recommendations come out of this reopening planning, that there's a level playing field, that whatever happens when we reopen, there isn't a system that would somehow favor the big guys over the little guys. What assurances can you give to small business owners that have that concern?
Yeah, Paul. First of all, look at our Business Advisory Council. You'll see it is overwhelmingly small business. It also includes the head of the Restaurant Association, the Hospitality Association. We have a big focus on making sure our small Main Street businesses get an opportunity to get up and running as soon as we can do that safely. One of the reasons they're on that committee is we're asking them for their best ideas on how we can safely reopen. You know, as you know, we never closed down, but it was just for pickup only in terms of those restaurants. And I think that's true pretty much around the rest of the country. And but the question is really well taken, because you remember the PPP program coming out of the federal government. A lot of the big restaurant chains ended up grabbing a lot of that, those forgivable loans, and some of the smaller restaurants didn't get anything. And we're working to make sure that doesn't happen and to focus on those small businesses.
I also had an opportunity to speak to the president of the Connecticut Retail Merchants Association, and obviously they have similar concerns. And one of the things that members are conveying is, or at least some members are conveying, is that waiting to June 1st is going to be a real hardship, a real challenge for some of them. What can you tell them that will about when they might be ready to open? Is it possible that they could open before June?
Well, it's possible, but it's going to be based on the facts on the ground. I've got a business team and I got a scientific team. And I don't want anybody to think we're out of the woods. As I talked about the flare-ups around the world and the flare-ups around the country and the flare-ups here in Connecticut, this COVID crisis is not behind us. You know, that said, we are working with these local merchants to work with them to come up with ways that we can safely get their businesses reopened, not just for pickup, but also for people going in. And I think that testing, at least fever testing, and perhaps masks are going to be a big part of getting those stores open sooner rather than later.
The Connecticut Retail Merchant Association is also represented on the Reopen CT committee. We're happy that Tim Phelan, who's the executive director of the Retail Merchant Association, agreed to serve. So we look forward to hearing his voice and his advocacy on behalf of the members of the Retail Merchants of Connecticut.
Good point.
Okay, and just real quick, the Congressional Budget Office is predicting, I think, a 12% drop in economic output, I believe, for the second quarter. Do you have any projections on Connecticut? What we could expect for the Connecticut economy?
Well, I was talking to Melissa McCaw today, and it looks like our revenues will be down for the fiscal year compared to what we had budgeted previously, about 5%. As you know, that's about $450 million. New York could be down a lot more than that. Florida could be down because they rely a lot more on sales tax. So we'll see how different states have different impacts. I'm not confident, but at least because of the manufacturing base that we have here, I think we have enough of our industries that hopefully we won't be hit quite as hard. But that means nothing if you're one of the companies that were hit starting in the service industry. So we take that very seriously.
Well, I'll add as well that there's going to be additional reporting that will have to be done on April 30th that OPM with OFA will be reporting out.
We'll move along next to Channel 3 Eyewitness News.
Yes, Governor, talking about the stages for reopening, I'm not sure where Georgia is in their stage, but they're going to be opening up early. Are you going to be watching what's happening there to see how it goes, as possibly for some guidance as to when we could reopen here, or is what's happening here in Connecticut not really comparable to what's happening in Georgia?
Well, I'm watching it very carefully. I thought it was premature. I thought opening those stores and businesses where you're least likely to be able to socially distance, like massage parlors, was the opposite of what my strategy is here. And secondly, I was sort of interested looking at the first day as they open in Georgia. A lot of people did not want to go to that restaurant or to that facility that maybe was open. I think you're going to see the consumer is using good judgment, sometimes even if the governor isn't.
Are there going to be things that you're going to be looking for like lessons learned as Georgia kind of starts to roll out?
Yeah, for one, just the nature of the consumer. I mean, I'd like to open up that small retail store, that dress shop, that toy store. And I'll be curious to see whether it's a big flood of people wanting to crowd in there because they've got a lot of pent-up demand. That would make me hesitate a little bit. Or if the consumer is hesitating and saying, I'm going to take a wait and see, then I think it's probably a more controllable situation with masks and social distancing, and I'd be more likely to be aggressive on that.
Move along next to Boceto Media.
Good afternoon, everybody. Since we're thinking about reopening Connecticut, Governor Lamont, are polls going to be open on election day? And what will be the restrictions considering the safety recommendations? Are you considering absentee ballots for primary or general elections? And also, my second question is, going back to the nursing homes, will the state of Connecticut fine those private facilities that are not complying with the safety measures to protect their workers? Thank you so much.
Yeah, I was just talking to the Attorney General and our General Counsel on the voting issue, first of all. As you probably know, we have pushed off voting now till August, so we'll see what the lay of the land is there. But I'm not sure that people over the age of 65 or 70, I think they may still be in a stay safe, stay home mode unless it's absolutely necessary. So I'd like to find alternatives, at least for them, to make sure they don't have to go to a polling booth. So we're working on that right now as we speak. Do you want to take the other question, Josh?
Sure. Yes. If there are issues at nursing homes, we investigate. If the investigation is substantiated, our Department of Public Health Commissioner has broad authority to issue fines or, in extreme cases, to revoke the license of a home as well. And so that is a constant area of focus for our Public Health Commissioner and the investigators there.
Move along next to the Day of New London. The Day of New London. News 8.
Josh, you've been investigating and looking at 2/3 of the nursing homes in Connecticut. What are you finding? Are they overall in good shape, poor shape, need more PPE?
Overall, they're doing well given the circumstances. A very stressful time, obviously, in those facilities. A lot of people working very hard in very challenging conditions, as they are around the nation and around the world. There have been some issues identified with best practices around donning and doffing PPE, proper cohorting and infection control procedures. But Barbara Cass has told me that the issues are not widespread, and where they're identified, additional trainings being provided every day by our DPH team. So there are learnings in some cases, but overall, generally, folks working very hard and under very difficult conditions.
Have you had to fine anybody?
Not yet.
Okay. And then also, the union is reporting deaths, and I know numbers are numbers. We haven't heard all the numbers, but they're saying the death toll coming out of the nursing home could be making up 50% of the population in Connecticut of the numbers, and they say they're being underreported. It's hard to calculate numbers, I know, but where do you see it fitting in?
So we'll be releasing the detailed breakdown on all the nursing homes with at least one case in tonight's press release. As of today, the number of deaths in nursing homes or from nursing home patients who were transferred out to hospitals and subsequently passed away represents 43% of the total deaths, so 768 deaths related to nursing homes.
Okay, and then one quick question for the governor. We have a lot of people in the salons, the barber shops, wondering if they can do one-on-one, do it safely. I know you've been asked this a lot, but people are wondering, can they get back to work with that?
Yeah, we're definitely taking a look at that, but if we could test the barber, that would mean a lot less contagious for somebody that he's barbering. If a barber had a N95 mask or a KN95 mask, that would be more protective, or at least just a surgical mask. Maybe a fever meter for the person who's coming in, just to make sure that they can't transmit to the barber. So there are a few different ways we can, get to a place where they can open up on a selective basis, and we're going to have more direction on that from the task force, I think, within the next week or two.
Move along next.
Thank you, Governor.
Move along next to Hearst, Connecticut Media.
Hi, Governor. Can you hear me?
Sure. Hey, Ken.
Thanks. It just, maybe I've been working so many hours because it just dawned on me that I probably can't eat a plate of spaghetti with a face mask on. But this kind of relates to what you were saying on CNN today. Truth be told, it looks like restaurants and bars are going to be the last places to open, it seems. Do you gather it that way? Yeah, they're doing takeout, but a lot of them are having a hard time surviving.
No, Ken. That's one of the reasons I love Deirdre Gifford's idea for the restaurants, of get them part of our food supply chain so they can make meals and we can have those delivered, and we provide some commercial opportunity for them. The White House Task Force has sadly said that probably restaurants and bars will be further back in terms of how things get opened. But you could have an outdoor restaurant. You could have restaurants where the seats are further apart. We could have restaurants where perhaps the waiters wear face masks and even gloves. So there are ways we're trying to think, ways we can get back to work safely.
Thanks. And can I ask Kathleen a question, please?
Certainly.
There's this raging controversy around hydroxychloroquine, and I wanted to know if you folks have a protocol in place to either continue using it or not at this point.
Yeah, so there initially it was used as a therapy, as different types of therapies were being tried to see what would be efficacious. And what I heard this morning from our infection control physicians is that there's now been a small study that has indicated that it is not efficacious in the treatment of COVID-19, and we are no longer going to use it. So there's going to be new guidelines in our organization, and I'm sure others will look at these studies and the evidence, and will make those decisions appropriately.
And Governor, are you just going to let the hospitals decide for themselves on that, let the doctors decide?
I think so. You don't need the governor to get in the way of between a doctor and their patient.
Sure, thank you.
Hartford Current.
Hello, Governor. Are you concerned that the nursing homes, or at least some of the nursing homes, are not giving accurate information about the deaths and are frankly downplaying it? We hear about different deaths there, and then we find out later that they were COVID related. Are you concerned you're not getting accurate information?
Josh can better handle that, but I would say there's been a lot of discussion about what is a COVID-related death. I think we've talked about that before, and many people die of complications related to COVID. And I know the task force, again, has a universal definition out there that says if found to be infected, if found to be showing symptoms, that will be treated as a COVID-related death, and they're fairly clear about that. Josh, perhaps the nursing homes are still coming up with to the definitions.
Yeah, I mean, I think in their defense, it's a complex thing to track it sometimes. They may send a resident to the hospital who might be sick but maybe hasn't yet been tested for COVID. They get tested at the hospital. Perhaps they pass away at the hospital. How the nursing home keeping track of that sequence of events sometimes can have a time lag associated with it. But I think to the premise of your original question, Chris, although we don't have any immediate evidence that that's happened, as you know, the governor put in place an executive order yesterday, I think it was, or the day before, that added accurate reporting of data to the list of items that could be cited by our Commissioner of Public Health and fined if it's not being done properly.
Okay, and also, Josh, one follow-up. At one point we were getting information on the number of COVID patients who were discharged from the hospital, and then it seemed that we weren't getting that. In Stamford on this call, we just got anecdotally, we heard about 215. But can you get us comprehensive information on that on a statewide basis?
Absolutely. In fact, I can tell you right now. Just got to pull up the file. I'll get back to you, Chris. I'll send you the number offline.
Okay.
Move along next to Connecticut News Junkie.
Thanks for taking my call. So I wanted to know about testing of nursing home workers. Since visitors haven't been allowed in nursing homes, nursing home workers, are they able to get the test? Are we getting the testing that we need to nursing homes?
Why don't you take that, Josh?
Christine, I think like a lot of areas, we want to do more. And as General Yvonne mentioned earlier, and I know Kathy and a lot of her colleagues, other hospital CEOs around the state are looking at additional opportunities to get more testing out to the nursing homes. We'd like to do more there. We'd like to do more in our corrections facilities. So this is all critical priorities for us as we look to scale up our overall testing capacity in the state.
And then I have a question for Kathy. How much healthcare are people delaying, and what is going to be the impact on the system? Are we going to see a second surge, not necessarily a COVID surge, but a surge from delaying of putting off necessary medical treatment?
Yeah, we are concerned about that, as I mentioned before, that because of fear of going to the hospital, and it's not just hospitals, any healthcare environment, people are putting off getting their normal health care. And people have chronic diseases. They have needs that have to be addressed. We're obviously not going to perform elective surgery or an elective procedure during this period of time on a patient, but people are perhaps neglecting the care that they truly need, and could create a surge and could create more prevalence of disease later on. So we want everyone to stay in touch with their physicians, communicate with them, and make sure that they are taking proper care of themselves, filling their medications. And if they need to seek care, they can seek care. As I mentioned this morning, our census for non-COVID patients exceeded COVID, and that's very important. We had to perform some urgent orthopedic procedures for injuries yesterday. So we still can take good care of patients, even though we're not doing elective postponable types of procedures. So that's a public health message that I would like to get out to the community.
Fox 61.
Zania Maldonado, Fox 61. I have a question for Josh in regards to the executive order finding nursing homes $5,000 for not reporting infection data. Will nursing homes also be penalized for things like infection control and patient communication violations? Is there anything else besides reporting infections that nursing homes could be fined for?
Unmute. Unmute. Josh, unmute.
Let me just say that there are other things that a nursing home can be fined for, and we're keeping a close eye on the situation because there are a lot of lives at risk.
Josh, want to try again? You're still muted. Try again.
We'll come back to him, Max.
Also, that right now the Department of Public Health is investigating these nursing homes. But Governor, would you possibly follow suit with New York in having the Attorney General's office investigating these violations?
My hunch right now is we're not there. I think we're just doing the investigations, and Josh and Renee, Commissioner of Public Health, we're in there. We're finding no major violations. We're very strict in terms of what the protocols are going to be, very strict in terms of what you got to do in terms of infection, very strict in terms of what you got to do in terms of hygiene, very strict in terms of what you got to do in terms of reporting. And if they don't get it right, then we'll come back and take another look.
Move along next to WTIC 1080 News.
Kathy, a question for you.
Yes.
When the chief executive uses the bully pulpit to even utter the suggestion that humans use household cleaning products to somehow heal anything, that's something my 12-year-old was laughing herself sick at this morning. What's the impact on the medical community when a person who is in that position uses that stage to present something that's absurd to everybody?
I just want to clarify the question. Is it that you want to understand how we would approach someone using non-approved cleaning products?
No, what's the talk in the healthcare community when you hear someone so powerful suggesting something so silly?
Well, I would certainly not advise for anyone in the healthcare community to give advice about using unacceptable cleaning products. There are ways, and if you can't get the traditional things that you purchase normally for your home, that you can research what exactly you can use and how to prepare that safely. I actually saw a segment this morning on the news about how to prepare a small cleaning product with a small amount of Clorox and water, and that you could use that for a week. So there is available information on what is safe and effective if you can't get the traditional products that you would use. But my advice would be to be very careful about using non-approved mixtures of cleaning products, because they can be very dangerous.
Okay, sorry to drag
Add
you
to that
into
if
that.
I could.
Okay.
It's incredibly unfortunate when somebody in such a position of power with a bully pulpit makes flip comments like that about ingesting these disinfectants and cleaning products and Lysol and the such. It's absolutely wrong. It's dangerous. And I urge each and every one of you, don't even take it as a bit of humor or sarcasm. Make sure your kids know that this is something that's dangerous and should not be allowed.
All right, sorry to drag you into that one. Also, the nursing home numbers were due yesterday from DPH. Now you say they're coming in a separate release from the governor's office, I guess, tonight. Is there a particular reason for the delay?
Yeah, can you hear me now?
Yep.
Gotcha.
Yeah.
The delay is just the complexity of compiling the report. I gave a couple examples in a prior instance of having to triangulate between multiple sources of data with patients coming and going from nursing homes to hospitals, the different sources of data around death reporting. So it's just a very time-consuming, labor-intensive process, and given the importance of the numbers, the team just wanted to make absolutely certain they got it right.
Move along next to the Connecticut Mirror.
1199, the Healthcare Workers Union said today that at least some of these nursing home inspections were conducted by telephone. Is that correct?
Yeah, so there's yes. Although, as the governor said, over 2/3 of the nursing homes have now been physically visited for inspection as well. So both are happening on a daily basis.
Well, okay, when you first announced the nursing home inspections, I think the assumption was that a bare minimum, you're going to have state public health workers walking into nursing homes and ensuring that workers had appropriate PPE and that there were basic protocols being observed about how to deal with contagions. So what is the purpose of a telephone inspection? What can you get done?
So it's being done via FaceTime. So you have the video. And so what they'll also do is ask the operator to, walk them from where the patients are to the room where the PPE is stored while keeping the video running. So you can actually, through a video, a FaceTime session, you can actually accomplish a good amount. But they are sending people on site as well, Paz.
What's the breakdown? How many of these inspections are done via Zoom or other video conference versus having somebody physically present?
I'd have to get back to you on the breakdown.
I mean, one would think that part of an inspection would be to be able to converse with employees there on site and check to see, what is the general availability of masks and gowns and whatnot.
I think you're right, Paz. There's a timing issue. We got as many people as we can doing as many physical inspections as we can. As Josh said, sometimes FaceTime allows us to get to more nursing homes faster, but my goal is to have every single nursing home with a physical inspection so we can talk to people and find out exactly what's going on.
So what's your confidence level at this point as to whether or not you know what indeed is going on in those nursing homes?
Well, I mean, there's 215 nursing homes in the state, Paz, so we're working our way around them consistently as we find things or as issues are reported into DPH. They're all chased down and investigated, and that helps inform the order at which investigations are conducted as well. So, the team is out there every day chasing down any issues that come up.
And I'll let you go, but what does that team look like? How many people are on a team? And how long are they on site when they go to these places?
I can get you those details as well.
Thank you.
Move along next to NBC Connecticut.
Good afternoon. Governor, you said if the hospitalizations continue on this downward trend, in a week we could be at phase 1 of the federal reopening plan. That would mean elective surgeries can resume, gyms might be able to open under strict sanitation rules. So when you get your report from your task force, will you be considering opening anything before May 20th?
I think when we look at that tier 1 spot, we have an opportunity per the COVID task force that gives us some flexibility. So I'm going to wait and listen to what the task force says, see where we are in terms of infections and hospitalizations. But as you know, hospitalizations was key because that told us what capacity we had to make sure we could take care of people safely.
We've been hearing a lot about the possibility of a second surge this fall. I know you've set up several field hospitals. You also have the convention center set up. Will you keep all of that set up into the fall in case we do have another surge?
I think I'll talk to the professionals on that, but to tell you the truth, it makes all the sense in the world to me because I'm just looking around the world and I see what is happening. I see what the head of the CDC said. I see what Dr. Fauci said. They said, be careful. You could have a second surge, and it could be as severe as the first one. And I want to make sure that we have all the PPE we need, make sure we're prepared for that. We have the beds as well, which gives me a chance to say a thank you. That's to Raytheon Technologies, or as we say in Connecticut, the band formerly known as United Technologies. And they've just made a large donation of PPE, 455,000 KN95 masks, 325,000 surgical masks, plus coveralls to make sure that more people are protected, both in our nursing homes and broadly in our community. So I say to Greg Hayes and our friends at United Technologies, thank you there for what you did. I got to say, Kathy, Stanford Health is so fortunate to have you there. You turned the corner. I love the way you worked in fellowship with not just the Guard, but your fellow hospitals, made sure that we always had the capacity there during a tough time. And General Yvonne, give my best to the Guard. I mean, they did amazing work. I was there at Southern. I know those guys had recently come back from Afghanistan, and there they were setting up the field hospital. And a little bit of my heart goes out to the guys who were at Guantanamo now doing CCSU. Thanks, everybody.